Hi, I'm Fabrizio La Rosa, an osteopath from Palermo. I've created the NEURORESET method. This method is useful to treat patients affected by CRPS or joint blocks. In this second part of my program, I will talk about how CRPS occurs, what are the causes and consequences of CRPS. CRPS is almost unknown to medical practitioners. It's a disease that has been studied for a long time. The first doctors that conducted a study and gave particular attention to this disease practiced in 1766. They noticed that some of their patients after a surgery or trauma as a consequence were suffering of an excruciating pain. Instead, other patients with the same trauma didn't suffer as much as the others, thus recovered more quickly. This began to tickle interest in some doctors, and in particular in Dr. Mitchell, that treated soldiers during the American Civil War. What he noticed was that some of these soldiers had no possibility to recover from the injury, even if they had less important traumas than others. How come all this occurred? Dr. Mitchell asked himself. Why these patients didn't recover like others and became disabled, and others that had had the same injuries recovered totally? This is the question that until today has no conceivable answer. It is believed that all occurs from psychological and neurodegenerative problems. Today, it's believed that all occurs from a dysfunction of the autonomic nervous system. That is also my belief. In fact, CRPS is a normal response of the body to a traumatic event that reiterates in time. The response that our autonomic nervous system sends to our body after the injury occurs happens in a couple of minutes, and it wears out after a couple of hours or days in case of surgery. But when we talk about CRPS, this doesn't happen. The pain and suffering continues endlessly. It's like an alarm that went off and doesn't stop ringing. So we need to reset the autonomic nervous system. That is the reason that I have discovered and developed my method, so-called NEURORESET. The research for the method goes back to many years ago, when after having watched many physiotherapists while treating patients that were affected by CRPS and having noticed that satisfactory results weren't achieved, I began to ask myself, how come some patients that had had such bad injuries or difficult operations had recovered quickly, while others with less important injuries entered in a dark tunnel with no way out, made of excruciating pain, exaggerated for the injury that they were subjected to? When CRPS occurs, the injured limb is swollen, hot, painful, red and useless. It has lost its natural functions. The skin is wet and smooth. These are the 5 characteristics that we should memorize, because these answer to the description of the inflammation. And as I said previously, CRPS is the response of our body when we have an injury. Unfortunately, my dear friends, this normal response becomes a never-ending story.